Welcome to our educational programme for patients with POTS. We are delighted to welcome you and hope you will find this series of videos helpful whilst you are awaiting your first appointment. We appreciate that the wait can be long and how frustrating this is when you are feeling so unwell. This programme has been carefully designed to try and help you implement lifestyle changes that will start to make a difference. We understand people watching these videos may be at different stages of their journey, but all of the resources provided may help whatever stage you are at.
Hi, my name's Dr Boon Lim and I'm the General Manager for POTS UK.
Hi, my name is Boon Lim. I'm a consultant cardiologist based at Imperial College, London.
So I'm here today to guide you through this educational programme for patients. Dr Lim, can you tell us a bit about this programme that's aimed at patients getting the best out of their first appointment?
Yes, Joe. Well, we've put together a program which is going to be a series of videos to help you understand your diagnosis and, importantly, what steps you can take before you go for your first appointment to help you feel better.
We will now look at the aims of this educational programme. Firstly, to enable patients to learn about, implement and benefit from lifestyle changes ahead of their first appointment, to allow them to have more control over their health. Secondly, to help patients prepare for their first appointment in order to make it as effective as possible. Thirdly, for patients to have implemented the foundational lifestyle therapies in order to move on to the second stage of treatment, i.e. medication, where appropriate at the first appointment. Finally, to improve understanding of what patients can expect from that first appointment.
So Dr Lim, what would you advise are the right building blocks that patients need to improve their symptoms?
So that's a great question, Joe. So I often think of an analogy of building a house. And I think at the ground floor of the house, the patient needs to understand what they can do for themselves to build lifestyle and conservative treatments to anchor down all the things that they have control over to improve their condition. Now, on the first floor of the house is where they can get into specific therapies like drugs to help further improve the symptoms. But the purpose of this series of videos is really to understand the foundational aspects. Now, if we go to the underpinning of this house, so you have the ground floor, which we talked about, the patient's conservative and lifestyle strategies, and the drugs on the first floor. The underpinnings of the house and what anchors down this is actually patient education. Because what I've found in experience is that if a patient understands why the lifestyle therapies and the conservative strategies like drinking water, having good sleep routines, having salt therapy, something that we'll discuss more in the series, are so important in helping to improve their health, then at the three levels, the understanding and the motivation are instilled as the underpinnings of the house to help your conservative measures. And if that's not enough, then when you see somebody like me or a healthcare professional who can prescribe something else to help you move along, it often engenders the best conditions for you to improve the health successfully.
So why is it so important that patients engage with the content and what impact will this have for them?
So the content that we're about to deliver is very well thought of, or we've thought about this for a long time. And actually the communication and the wording and the narratives that we use in this series of videos that we're about to present can be very helpful for patients or for you to understand why it is important to do the things that we are trying to explain. So I think this educational series will be extremely helpful to anchor down the motivation to succeed.
Okay, thank you. And I think the question that everybody always wants to know is how long will these changes take to have an impact?
It's a good question, and it's impossible for me to have answered that question for any individual patient. But I think we also have to think of mindset here and what you're expecting. And oftentimes I see patients who come after waiting such a long time, waiting for a silver bullet. And actually, in truth, in reality, the foundational aspects, so the ground floor analogy I use with all the things that you're doing will get you into a place of ideally safety and of an awareness of the triggers that would make you feel unwell on certain days and better on other days. And in managing your expectations and having a depth of understanding of why you might be feeling unwell on one day but not the other, say a hot summer's day, can often be very challenging for a patient with POTS. But on a day that it's pretty cool, you've had a good night's sleep, can be a good day. Understanding that waxing and waning type of presentation of symptoms can really help you see and you feel more empowered to be in control. And it's not always the case when you have a bad day, things are getting worse. You can have a bad day because it's a bad day. All of us have bad days. The purpose of this is to really allow you to understand that you should continue to focus on all the things that can make you better and that every little helps. And you should not give up hope.
Okay, thank you. And what challenges do you feel that patients may encounter? You talked there about potentially the fluctuation in their days. Is there anything else you feel that they may encounter, when implementing the lifestyle changes that we'll speak about later in the program?
So one of the greatest challenges that I see is the expectation gap. So patients come away from clinic and they feel that they've been told to drink a liter of water, say by breakfast time, with a teaspoon of salt. And they do that for 2 days and they find themselves still heavily symptomatic. That challenge, which is a kind of mental challenge of accepting that it might take a longer while to get better, or the challenge of not feeling better when you've done everything that we're asking you to do in this video series, is one of the major things that I see. And it's only major in the sense that it demotivates potentially the patient to say, this doesn't work, drinking doesn't work, salt doesn't work, I need a drug, and I need the drug from the specialist, and I need it next week, when your outpatient appointment might be several weeks or months down the road. So I want to manage expectations in this series and to explain that actually anchoring down the foundational aspects are super important, and actually being kind on yourself in the day-to-day waxing and waning of your symptoms is one of the major things to start to understand to anchor down your health and well-being.
Okay, that's great advice. Thank you. I think it would be a fair challenge for a POTS patient to say, why have I got to do all this work prior to my appointment? Lots of conditions, people with lots of different conditions wouldn't have to do this level of work before their first appointment. Why is it so critical for POTS patients to go ahead of seeing their GP or their consultant to have this information?
That's a really important question, Joe. And the answer is, you have a responsibility for your own health. And actually, the power of healing, particularly with autonomic conditions like POTS, lies predominantly with you and not with the person outside of you, i.e. your GP, your cardiologist, your POTS specialist. And so it is really worth your while to educate yourself. We talked about the foundational elements. I want us, at the end of this series, for you or the patients to understand the underpinnings of health and well-being is education and understanding and instilling motivation to do the right things on the ground floor, which are the conservative strategies. And then recognizing that the person who can help you on the first floor is very limited, as in we're going to prescribe drugs as doctors, but we can describe all the drugs in the world that we know. If you're not drinking enough, if you're sleeping 2 hours a night, if you don't understand or disagree that having salt could be helpful when you have a low blood pressure, and so you don't take salt, and you don't pace yourself, it's very difficult to see how you can ever have a silver bullet that somebody can cure. So part of this work you have to do is not only educational work, and it's certainly not necessarily only to help the physicians you're going to be seeing. It's mainly about helping yourself.
Yeah.
There is no, in my opinion, never any harm to enhance your education and to learn and become more self-aware of your condition and anchor down the strategies that can help you move and shift in the right way. And the purpose of this series, which is a series dedicated to the patient, who hasn't seen their consultant yet, i.e. pre-first appointment advice, is because we hope a significant proportion of patients, once they watch what we've created, will be so much better that they may not need to take drugs.
Okay, thank you so much.
We have now reached the end of our introductory video. There are now a series of further videos for you to watch in your own time. These will include an introduction to POTS and the autonomic nervous system, lifestyle changes including fluid, salt and diet, how to manage a temperature regulation, sleep and brain fog. We'll discuss POTS and mental health, and there'll also be demonstrations of different tests you can complete at home. We recommend watching the videos in order. They don't all have to be watched at once, so take your time and pace yourself. There is lots of supporting information on the POTS UK website, and we encourage you to familiarise yourself with these also. In summary, be kind to yourself. Don't expect things to change overnight. These are tried and tested methods, but they do take time, consistency and commitment. Have an open mind. Record your progress. Be patient. Small changes can make a big difference, and you'll be going into your first appointment in the best position possible. Finally, visit www.potsuk.org for lots of information and resources.